right? Or contraction, depending on what we're speaking about. But more specifically, this is where the smooth muscles that are lining our vessel are responding to different stretch, right? Remember, stretch, when you think about myogenic, always think about stretch. So if there's more stretch on the vessel wall, the smooth muscles here will respond by contracting. If there's less stretch on the vessel wall, the smooth muscles here will respond by dilating, right? Relaxing so that we can dilate that vessel. And so that is the mechanism that is responsible for regulating our arterial radius, but also responsible here for regulating our GFR. So the smooth muscles that are lining the afferent arteriole specifically are going to sense the increase in pressure that's coming in, and they're going to contract in response to an increased stretch. And just going back here, thinking about this image, if my pressure goes from, let's say, 80 to 150, that means more blood will be coming into my afferent arteriole. My afferent arterioles are going to detect that because there's going to be more stretch on the walls of that afferent arteriole. And what's going to happen is they're going to respond by contracting. And that is what's going to keep my GFR. It's going to lower my GFR, putting more resistance on that vessel and preventing more blood from being filtered. Okay, so even though my mean arterial pressure goes up, my GFR is actually going to stay the same because of this myogenic response of the afferent arterioles. The second response here is going, and remember, these cells that are lining here, we spoke about these cells before. So let's look at the second set of cells here. So we also did introduce this juxtaglomerular complex, which are the cells that are at play here. And so the tubular glomerular feedback, which is the second mechanism, is really reliant upon one of our group of juxtaglomerular cells, so the macula densa cells specifically. These cells are located here. They're lining the distal convoluted tubule. And just to remind ourselves, again, there can be some different sources that say different locations for these macula densa cells. This may be an image that is not from your book, and so it's actually listing the macula densa as being a part of the ascending limb of the loop of Henle, but for our purposes, we're going to keep the distal convoluted tubule. So just make a note of that. You can actually just replace that here so you're not confused. So we've got our macula densa cells. They're present, located at the DCT, the distal convoluted tubule. And these cells are also detecting how much fluid is coming through. So they're detecting the later parts of the tubule, essentially how much filtrate is moving through the tubular structures. And they're going to respond and send signals to the smooth muscle cells of the afferent arteriole that will again respond appropriately. So let's say my mean arterial pressure again rises, more fluid ends up being filtered across my glomerulus and ends up in my tubular structures. More of that fluid ends up in the distal convoluted tubule. It's going to put more of a stretch on my macula densa cells. They're going to pick up that more fluid is coming through here. And the way that they're going to respond is sending signals. These are what we call paracrine signals or chemical messages to the afferent arteriole smooth muscle cells. And they're going to instruct those cells to do the same thing that they would do if more fluid was coming through here. So they're going to constrict so that less fluid is coming through the glomerulus, less fluid is being filtered, and by extension, less fluid ends up down here in the distal convoluted tubule, okay? So it's essentially the same feedback response, but it's different signals, or different sensors rather, that are picking up that increase in filtration and sending the signals to the afferent arteriole to decrease their flow rate in order to decrease GFR. And the third mechanism is involving the mesangial cells. The mesangial cells are the ones that are located in between here at the vascular pole, so in between our afferent and efferent arterioles. And these are the cells that will pick up, again, any increase in stretch. And they can, again, send signals. If they're being contracted, they can send signals to the afferent arteriole to slow down the flow rate and decrease the GFR. So again, the overall response is the same. We want to decrease how much blood is coming into the afferent arteriole. We just have different routes or different mechanisms to send that signal to the afferent arteriole. All right. So this is just sort of summarizing or recapping what we said before in terms of location of these cells, we've got the afferent arteriole here. And remember, the cells that are lining the afferent arteriole are the granular cells, also known as the juxtaglomerular cells, right? I think that was the terminology that we used, but granular cells is an alternate terminology. We've also got the extraglomerular mesangial cells, the ones that are in between the ball of capillaries here. And then we've got our macula densa cells, which are actually lining the distal part of the tubule. All right, so let's apply that understanding here. Let's look at what would happen if mean arterial pressure increases. And remember, the end goal is, although mean arterial pressure increases, I want to keep my GFR constant, okay? All right, so let's look at what would happen. So increase in pressure coming into the afferent arteriole, that would cause an increase in stretch on the smooth muscle of the afferent arteriole. That would then cause constriction. So if I increase in my stretch, according to the myogenic response, the myogenic feedback here, I'm going to decrease the radius by increasing constriction. That is going to be increasing resistance, right? If I'm decreasing or contracting that vessel, that is increasing the amount of resistance that's in that vessel. What that would tend to do is decrease my glomerular capillary pressure, okay? Decrease my glomerular capillary pressure. And so what we do instead is we want to increase the glomerular capillary pressure, okay? So what we really want to do is keep GFR constant. So in the face of a drop in glomerular capillary pressure, I'm going to want to increase glomerular capillary pressure. And so that would keep my GFR up, even though the response to my arterial cells would be to try to squeeze down on those cells and decrease my GFR, okay? On the alternatively, if we look at the opposite scenario, if we have a raise in mean arterial pressure, that's going to be more pressure coming into my glomerulus. That's going to increase my glomerular capillary pressure. And again, if we want to think about, so this is the, actually this is the same mechanism. Excuse me, I'm kind of losing my train of thought here. So this is the same instance, same scenario. We have an increase in mean arterial pressure. What we're looking at is a different mechanism for correcting that. So I apologize here. So we have an increase in mean arterial pressure. That is resulting in an increase in glomerular pressure. In other words, more fluid coming into our glomerulus. That results in more GFR, so GFR increasing. And the way that we do that is by constricting on our smooth muscle cells. And we have more fluid coming through the distal part of our capillary. Those cells there, the macula densa cells, are going to send paracrine signals to our afferent arteriole, and they are going to open up. They're going to allow for more flow, and that's going to increase our GFR. Okay, so it's the same response that we're trying to get at here, which is increasing our GFR, but the mechanism for doing so is different. And we really want to appreciate that if we were to allow the kidneys to respond naturally, if I raise mean arterial pressure, the kidneys will try to drop my glomerular capillary pressure as a response of those cells. But to avert that and to keep GFR up, we're going to have the macula densa cells on this scenario, or excuse me, hang on here, the myogenic regulation, right? So the stretch of those afferent arterial cells here, but then on this scenario, we've got the macula densa cells and those paracrine signals, okay? So that was intrinsic mechanisms of regulation, so local things that we can do. And lastly here, we'll just introduce some of the extrinsic mechanisms. So here we're looking at hormones, the autonomic nervous system. And so if we decrease our blood pressure, we decrease GFR, but this can be done extrinsically, so not involving the local cells that are in the kidney. And this is done both directly, right? Just naturally, if you drop blood pressure, less blood is coming to the kidney. So directly, you will also decrease your filtration pressure, but indirectly as well with the involvement of the sympathetic nervous system. So let's look at this flow chart to sort of highlight that. So if I've got hemorrhaging going on, I'm losing blood pressure, my mean arterial pressure drops, blood volume drops, venous pressure drops. What we know based upon our previous discussion is that the baroreceptors are going to kick in. If there's a drop in blood pressure, the baroreceptors are going to do all that they can to send signals via the sympathetic nervous system in order to raise that mean arterial pressure. via many of the mechanisms that we talked about before, such as raising TPR, et cetera. But what they're also going to do is increase the sympathetic signals that are going to the kidney. And the sympathetic signals cause vasoconstriction. So there's going to be vasoconstriction of the afferent and efferent arterioles, which would drop GFR, okay? And as we drop GFR, we decrease urine flow, we decrease fluid loss. So this is going to correct our initial signal, which is hemorrhaging, dehydration, excess sweating, and things like that. And this is what we mean by that extrinsic mechanism. So we're using the sympathetic nervous system, which would respond to normally try to raise mean arterial pressure by sending sympathetic signals to all parts of the body, but specifically the signals that come to the kidneys cause vasoconstriction of our afferent and efferent arterioles, which cause increased vascular resistance in our kidney vasculature, right, the blood coming into the kidney, which will drop the GFR, less blood can come in, so GFR goes down, less urine can be filtered, and less fluid can be lost, right? And that would correct our initial problem of having hemorrhage or increased blood volume loss.